What is the difference between NVLD and ADHD? What is the difference between nonverbal learning disorder and attention deficit hyperactivity disorder? These two neurodevelopmental conditions can share some symptoms, but they are quite different in many ways. Nonverbal learning disorder primarily involves challenges with nonverbal communication, visual-spatial skills, and fine motor coordination. People with nonverbal learning disorder often have strong verbal abilities. They tend to remember spoken instructions well, but they struggle with interpreting nonverbal cues like body language and facial expressions. This can make social interactions difficult. Additionally, individuals with nonverbal learning disorder may have trouble understanding complex visual or spatial information. This can lead to challenges in subjects like math or tasks that requiring visual organization. These difficulties are consistent and do not change based on motivation or interest. It is important to note that nonverbal learning disorder is not formally recognized in major diagnostic manuals, which can lead to it being underdiagnosed. On the other hand, attention deficit hyperactivity disorder is characterized by issues with attention, impulsivity, and hyperactivity. It is officially recognized in diagnostic manuals and has 3 subtypes: inattentive, hyperactive impulsive, or combined. Individuals with attention deficit hyperactivity disorder often find it hard to maintain focus and may get easily distracted. They might act impulsively without thinking and have trouble sitting still. Unlike nonverbal learning disorder, the symptoms of attention deficit hyperactivity disorder can vary based on interest or motivation. For example, someone with attention deficit hyperactivity disorder may focus well on a task they find exciting but struggle with less engaging activities. When it comes to academic performance, those with nonverbal learning disorder consistently face challenges in specific areas, particularly math. In contrast, individuals with attention deficit hyperactivity disorder may experience varying academic success based on factors like teacher engagement or personal interest. Another key difference is how each condition responds to treatment. Symptoms of attention deficit hyperactivity disorder often improve with medication and behavioral strategies. However, these treatments are generally not effective for nonverbal learning disorder. Misdiagnosing nonverbal learning disorder as attention deficit hyperactivity disorder can lead to inappropriate medication use and frustration for both the individual and their family. From the perspective of autism spectrum disorder, nonverbal learning disorder shares some similarities, especially in social communication difficulties. Both conditions can involve challenges in interpreting nonverbal social cues. However, individuals with nonverbal learning disorder typically have strong verbal skills and do not show the broader range of repetitive behaviors or restricted interests seen in autism spectrum disorder. Understanding these differences is essential for accurate diagnosis and support planning. Recognizing whether someone has nonverbal learning disorder or attention deficit hyperactivity disorder can significantly impact the type of support they need. Nonverbal learning disorder interventions focus on improving visual-spatial skills and social skills training, while attention deficit hyperactivity disorder support emphasizes managing attention and impulsivity.